This article published in the Journal of Ayurveda Physician and a Surgeon. The name of this article, Clinical Study on the Efficiency of the Vamana Karma in Hypothyroidism, written by the Dr. Gaurang Lineshwala, Gaurdeep Singh and the Behera PS. Abstract. Kapha dosha plays a major role in the pathogenesis of hypothyroidism as a diminished Agni, and the slowness in the body function is the characteristics feature. Diminished Agni, hypothyroidism, and slowness in the body function. In Ayurveda, it can be correlated with the Kafaja Galagandaha. Kafaja Galagandaha. Both Sushrut and Vagbhat has a prescribed Vamana Karma in the treatment of the Kafaja Galaganda. Therefore, this study was carried out to evaluate the role of the Vamana Karma in the management of the hypothyroidism. The result of this study show that Vamana Karma provides significant relief in the symptom of the puffiness of the face, edema, generalized pain, dry skin, excessive sleep, lethargy. It is also significantly reduced the body weight, body mass index. Vamana Karma provide a moderate improvement in a 28.6% patient and mild improvement in a 71.74 patient. Introduction. Hypothyroidism is a common endocrine disorder around the world. It affects the body physiology as well as the psychology. In Ayurveda, hypothyroidism is not mentioned as such, but on the basis of its clinical presentation, it can be correlated with the Kafaja Galaganda as its local symptoms resemble with the thyroid gland, and the Kafaja Sajavikara for its general symptom. Sushrut and the Vagbhat both have prescribed Vamana Karma in the treatment of the Kafaja Galaganda. Taking these point in the view, this study was a plan with the following aims and objective to evaluate the role of a Vamana Karma in the management of the hypothyroidism, materials and the method. 7 patients of a hypothyroidism admitted in the IPGT and the RAGAU Jamnagar hospital were selected for the present study. Vamana Yoga and the Vamanopaka drugs are prepared at the IPD before conducting the Vamana Karma. Criteria for the diagnosis: the patient were diagnosed mainly on the basis of a clinical feature of a hypothyroidism, that is a weight gain, puffiness, edema, anorexia, generalized pain. The positive thyroid profile of the hypothyroidism was also taken into the consideration. The previously diagnosed patient were included in the study. Routine hematological test, routine and the microscopic examination of a urine and a stool. Serum cholesterol were also carried out to assess the condition of the patient as well as exclude the other pathologies. In doubtful cases, the biochemical examinations such as the serum T3, T4, TSH were done to confirm the diagnosis. Management: the patient of a hypothyroidism ready to undergo the Vaman process were prepared with the internal Snehan by giving a 30 gram of a ghee at about 7 am once a day. On the next day onward, dose of a ghee was gradually increased by about 30 to 50 gram per day depending upon the digestive response of the previous day. Light and hot diet was allowed only after the digestion of the ghee. The ghee administration was continued still the Samyak Snehana symptom were obtained. Then a 1 gap day was kept, and on that day Abhyanga of the whole body was done for about 20 minutes in all the 7 positions with the Vam Bala Tela followed by the Vasap Sweda Tila Samyaka Swedana symptom were obtained. The Abhyanga and Vasapa Swedana was done in the morning at about 10 am and in the evening at about 4:30 pm. Diet on the evening of a gap day. On evening of the gap day, special khichdi made up about 50 gram each of the rice and the udat, 25 gram of each tila and ghee was given along with a 250 gram of a curd. The salt was added as per the requirement. Vamana Karma. On the next morning of a Vamana day at about 6:30 am, patient was taken to the Panchakarma. Thereafter, where the patient was again subjected to the Abhyanga and Vasapasveda in a similar way as mentioned earlier. Then the patient was shifted to the Vamana chair where he was given to a milk up to the full stomach. After the 5 minutes, the mixture of a Madanafala, Pimpli Churnaha, Vacha Churnaha, Madhu, Saindavaha mixed in the quantity of 6 gram, 3 gram, 10 gram and 1.5 gram respectively, diluted in a 200 ml of Yashti Madhufant was given orally. If the Vamana Vega started within a 10 minutes, no Vamanopaka drug has given. If Vaman Veg not observed within a 10 minutes, Yashti Madhufant was given again. Even then, if the Vaman Veg was not occurring, then patient was instructed to touch his pharynx and these nail cut clean fingers. Vamanopaka drug Yashti Madhufant was also given in between the Vegas to enhance the vomiting. During the Vega, the patient was helped by pressing the abdomen with the palm. After completion of a Vamana Karma, the patient was transferred to the bed where again pulse, BP, respiration were noted. In the room, Dhumapan was done by the Nirodha Ayurvedic secret and the patient was kept in keen observation to the whole day. Sansarjan karma, depending upon the type of a shuddhi shown by the patient, Sansarjan karma as a follow. In case of a hina, madhyama and pravara shuddhi, peya, vilipi, mudga yusha and rice with a mudga yush were given for a 1 meal time, 2 times a meal and 3 meal respectively. From the evening of the Vamana day, patient were instructed that this diet was taken as per the appetite. Peya and the vilipi were prepared from the 50 gram of the rice as per the standard method. Mudga yush was obtained by cooking a 50 grams of a mudga in the required quantity of the water. In the last, odana prepared from the 50 gram of a rice along with the mudga yush prepared from the 50 gram of the mudga were given. Result, after the Sansarjan karma, the patient were assessed for the efforts of the therapy. The Vamana karma provided a significant relief in the sign and symptom as shown in the table. The effect of the therapy on the physical parameter is presented in the table 2 and the overall effect on the Vamana karma on the patient of the hypothyroidism is depicted in the table 3. These are the sign and symptom: puffiness of the body, edema, generalized pain, headache, muscle cramp, anorexia, constipation, dry skin, excessive sleep, lethargy, fatiguability, and the cold intolerance. Effect of a woman on the physical parameters, that is weight, body mass index, pulse, systolic BP, diastolic BP, and all. Then overall effect of a Vamana karma: complete remission, markedly improve, moderately improve, mild improvement, and the unchanged. Then discussion: in the hypothyroidism, slowness of the body function, excessive reduction in the digestion and the metabolism, solid type of edema are the cardinal symptoms which are according to the Ayurveda due to the excessive and the provocative of kapha. Ayurveda consider Vamana as the best treatment for the kapha and it's a disorder. Therefore, this study was a plan to evaluate the role of a Vamana karma in the management of the hypothyroidism. Vamana karma provides statistically significant relief in the sign and symptom of the disease, that is in 100% relief in a dry skin, 71% in a puffiness of the face, 66.7% in the generalized pain, 53.8% in excessive sleep, for 46% in the lethargy, 44.4% in the edema. It is provided relief in the symptoms as given in the table. Vamana karma provided no relief in the symptom of a hoarseness of a voice, loss of hair, and the forgetfulness. As long as the physical parameters are concerned, the therapy significantly reduced the body weight and the BMI. The therapy practically provided no significant effect on other physical parameters except diastolic BP. Vamana karma also caused insignificant increase in a systolic BP, but both remain within a normal limit, and these findings required further investigation. Consideration of overall relief provided by the Vamana karma to the patient of the hypothyroidism showed at the provides a moderate improvement to the 28.6% patient and the mild improvements in 71.4 patient, and no patient remain unchanged. Conclusion: Vamana karma provided a relief in symptoms of a puffiness of a space, edema, generalized pain, dry skin, excessive sleep, and the lethargy. Vamana karma significantly reduced the body weight and the body mass index. Vamana karma provide a moderate improvement to the 28.57% and the mild improvement to the 71.43%. Again, these are the bibliography. How this study show how the Vamana karma is effective in the hypothyroidism. Thank you so much for listening me.